Have you ever felt fine all day, but the exact second you put your key in the front door or pull into your driveway, you suddenly have an unbearable urgency to pee? You were fine 5 minutes ago. Then suddenly, you are rushing through the door, thinking, "Please let me make it to the bathroom." For some people, the urge becomes so strong that urine leaks before they get there. This phenomenon is often called latchkey incontinence or key-in-the-door urgency. It is closely associated with urinary urgency and urge incontinence, and research suggests that learned environmental cues can trigger a powerful bladder sensation. So how does your bladder seem to know you are almost home? And more importantly, why does this happen? I'm Ross, and today I want to walk you through what is happening between your bladder, your nerves, and your brain, because once you understand this connection, the sudden rush to the bathroom starts to make much more sense. And if you want clear, practical health information without complicated medical language, subscribe to the channel. Now let's solve this together. Your bladder is not simply a storage bag. It is part of a communication system. As your kidneys produce urine, urine travels down the ureters and collects inside your bladder. The bladder wall contains muscle called the detrusor muscle. As the bladder fills, nerves in the bladder wall send information toward your spinal cord and brain. Your brain then helps decide whether this is a good time to urinate. If you're sitting in a meeting, driving, shopping, or standing in a long line, your brain normally helps you keep the bladder in storage mode. The bladder holds the urine. The urinary sphincter stays closed. And you wait until you reach a suitable place. With overactive bladder or OAB, this system becomes harder to control. OAB is defined by urinary urgency, meaning a sudden, difficult-to-delay need to urinate. Frequency and nighttime urination often occur alongside it, and some people also experience urgency incontinence, where urine leaks after the urgent sensation. Now here is where the latchkey part becomes interesting. Imagine you have been holding your urine while driving home. You know your bathroom is waiting for you. You turn onto your street. Then you pull into the driveway. You reach for your keys. And suddenly, the urgency becomes much stronger. Your brain has learned the pattern: home, door, bathroom, urination. Over time, those environmental signals may become associated with emptying your bladder. So the sight of your front door, the sound of your keys, or even walking toward your bathroom might become a cue associated with urination. Researchers have found evidence supporting this idea. In one study of people with overactive bladder, participants reported environmental cues linked to urgency and leakage. Opening the front door of the home was one of the commonly reported triggers. Another study went further. Researchers exposed people with situational urgency to personal cues, including images connected with their own urgency experiences. These cues increased bladder sensations and produced changes in brain activity in areas involved in attention and bladder control. So this is not simply you making it up. There is a real brain-bladder connection involved. But there is another important question. Does getting a sudden urge when you arrive home automatically mean you have overactive bladder? Not necessarily. Occasionally feeling a strong urge when you finally reach a bathroom does not automatically mean you have a bladder disorder. But if you regularly experience sudden urgency, frequent trips to the bathroom, nighttime urination, or urine leakage, OAB is one possible explanation and deserves proper evaluation. And there is another reason not to assume every case is OAB. Urinary urgency has several possible causes. A urinary tract infection, for example, can cause urgency and frequency. Constipation can put pressure on the bladder. Certain neurological conditions can affect the nerves controlling the bladder. Diabetes can also contribute to urinary symptoms. In some men, an enlarged prostate can interfere with bladder emptying and contribute to urinary symptoms. Certain medications and drinks containing caffeine or alcohol may also worsen urinary frequency or urgency. This is why a good evaluation matters. When you see a doctor for persistent urgency, the first step is usually not an advanced bladder test. Your doctor will want to understand your symptoms. How strong is the urgency? Are you leaking urine? Do you wake up at night? Do you have pain or burning? Do you notice blood in the urine? What medications are you taking? How much caffeine and fluid are you drinking? Your doctor may also ask about bowel habits, medical conditions, previous urinary problems, and other factors that affect bladder function. A urine test is often useful because infection and blood in the urine need to be considered. Depending on your symptoms, your doctor may also check whether you are emptying your bladder properly. More specialized testing, such as urodynamic testing, is not automatically required for everyone with OAB. Doctors usually reserve more involved testing for situations where the diagnosis is unclear or additional information is needed. Now let's talk about what you can do, because this is where many people make the same mistake. They feel the urgency and immediately run toward the bathroom. But when this happens repeatedly, your bladder habits may become part of the problem. You start responding to every small sensation immediately. Your brain becomes accustomed to frequent emptying, and bladder training aims to gradually change this pattern. Bladder training is a behavioral treatment where you use a bladder diary and planned bathroom intervals to gradually increase the time between trips to the toilet. The goal is not to painfully hold your urine for hours. The goal is controlled, gradual retraining. So if you experience that sudden, "I'm home and now I desperately need to pee" feeling, start paying attention to the pattern. Keep track of when you drink, when you urinate, how strong the urgency feels, whether leakage occurs, and what was happening immediately before the urge. This information gives you and your doctor something concrete to work with. You may also notice certain triggers. For some people, caffeine is a major one. Coffee, tea, cola, energy drinks, and other caffeinated beverages may increase urinary frequency or worsen urgency in some people. Alcohol may also contribute. Carbonated drinks and certain foods bother some people as well. You do not need to assume every possible bladder irritant affects you. Look for your own pattern. If you notice a clear connection, reducing the trigger may help. But do not make the opposite mistake and severely restrict fluids. Your body still needs adequate hydration. Drinking too little may produce concentrated urine, which can irritate the bladder and worsen urinary symptoms in some people. Another important part of treatment is pelvic floor muscle training. Your pelvic floor muscles help support bladder control. A trained healthcare professional can teach you how to contract and relax these muscles correctly. For some people with OAB, pelvic floor muscle training combined with urge suppression techniques forms part of behavioral treatment. And there is an interesting strategy for the exact moment when that latchkey urgency hits. Instead of immediately panicking and sprinting toward the bathroom, try to slow the response. Stop for a moment. Take a controlled breath. Relax your body. Use your trained pelvic floor muscles if your healthcare professional has taught you how to do so. Then walk toward the bathroom rather than rushing. The goal is to interrupt the automatic urgency response cycle. Over time, bladder training works on changing the habit itself. And when behavioral approaches are not enough, there are medical treatments. Depending on your symptoms and medical history, a doctor might discuss medications for OAB. Two major medication groups include antimuscarinic medicines and beta-3 adrenergic agonists. Each has potential benefits and side effects, so the right choice depends on the individual. For people whose symptoms continue despite conservative treatment and medication, doctors also have other options, including certain nerve stimulation treatments and injections into the bladder muscle. Treatment is not one size fits all. The important point is that persistent OAB symptoms are treatable, and you have several evidence-based options to discuss with a healthcare professional. Now, I want you to remember one thing. That sudden urgency when you put your key in the door does not mean your bladder has somehow detected your bathroom. Your brain has learned a connection. The bladder and nervous system communicate continuously, and environmental cues associated with urination may trigger stronger bladder sensations. For some people, the effect is mild. For others, especially people who already have urgency or OAB symptoms, the signal can become intense enough to cause leakage. So if this happens to you once in a while, you do not need to panic. But if you regularly have sudden urgency, frequent urination, nighttime trips, or leakage, do not simply accept it as something you have to live with. And if you have blood in your urine, painful urination, fever, significant pelvic or back pain, difficulty emptying your bladder, or a sudden major change in your urinary pattern, seek medical evaluation. Your symptoms deserve an explanation. The good news is that bladder control problems have several treatment approaches, and early evaluation gives you more opportunities to address the cause and improve your daily life. So the next time you put your key in the door and suddenly feel like you have to sprint to the bathroom, remember this. Your bladder is connected to your brain. Your brain learns patterns, and those patterns can influence how urgently you feel the need to urinate. Understanding the pattern is the first step toward changing it. This video is for educational purposes only and does not replace a consultation with a qualified doctor. If you found this explanation useful, subscribe to the channel for more clear and practical urology and health education. I'm Ross. I'll see you in the next video.